Good morning, everyone. Welcome to our weekly media briefing for COVID-19. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start off with yesterday's numbers. We've had a total number of 2,284 confirmed cases, including 49 from Sunday and 56 from Monday. We have done 65,673 negative tests. We have 12 people hospitalized, including 4 in the intensive care unit. That number is inclusive, so the 12 includes those 4 who are in intensive care. We had some questions about that. We have 104 people in isolation. Those are people who have tested positive and are still considered infectious. Another 347 in quarantine, and we have had 32 deaths. As I would imagine you probably have all anticipated, I hate to have to share the bad news, but we have been moved into the purple tier for this week due to our increasing numbers. Right now, for this week, our adjusted case rate is 10.4. Last week, it was 7.5, and anything over 7 puts us in the purple tier. For test positivity, we're at 4.1, which is actually good. That's in the orange. Purple would be over 8, and red would be between 5 and 8. So anything under 5 would put us in the orange tier. So that's a positive number. We just need to get those case numbers down. I think that's all the introductory information I have. I'll introduce all of you, sorry. We have our health officer, Dr. Karen Ramstrom. We've got Donnell Eworth, the director of the Health and Human Services Agency. Matt Pontus is the CEO of Shasta County. We've got Dean Germano from Shasta Community Health Center and Mark Mitchelson from Shasta Regional Medical Center. Those are all the faces that I see. All right, do any of you have anything to share before we open to media questions?
I do. Good morning, everybody. What I wanted to share this morning is with our increased case rates, we're seeing transmission community-wide. And so that's having an impact on some of our kind of congregate kinds of settings that we wanted to share with you today. So our schools are doing pretty well in terms of not necessarily having transmission on campus, but more schools are involved. And so they're having to make decisions and respond to those cases to ensure that there's not exposure on campus. So we currently have 56 students and staff across 27 K through 12 and 1 Institute of Higher Ed. And that's in the last 2 weeks. And so those schools are having to take action and determine close contacts and then decide whether they need to go to distance learning, depending on the number of cases on campus. And so those are hard decisions for these schools, and they don't take those decisions lightly. And so they can make those decisions for a variety of reasons and do whatever action they feel is necessary to protect their students and staff. So that's happening because we have more transmission in the community, and because those students and those staff in their personal exposures our personal lives are getting exposed and then being identified when they come to school. So just a reminder to everybody, there's just more transmission right now wherever you go. And even if it's around people that you are close to and you see regularly, if you're in close quarters and having close contact, everybody's at risk right now. So we want people to take extra care and make sure that you're limiting those close contacts to your household members. In addition to schools, we're seeing more cases in various settings of congregate living, including our skilled nursing facilities, assisted living, group homes, such as for individuals with disabilities, a variety of inpatient settings for mental health or other types of services. And so that's across multiple types of facilities community-wide. And again, those are vulnerable populations. And so those are related to people who work in facilities and bring it into the facility, because most of those facilities, the individuals there don't have a lot of movement in the community. And so another caution to people who work in those kinds of facilities to take extra care in your own personal lives about where you're going and who you're exposed to. Now is particularly important time to do that because we have a lot of transmission in the community, as Carrie shared. our case rates are quite high. So no particular areas in the community that we can say. It's wherever you go where there are people who are in close proximity and indoors. Those are the types of situations that are particularly risky. And so we recommend physical distancing and mask use and trying to avoid those kinds of situations if you can. And that's all I have this morning. Thanks.
Thank you, Dr. Ramstrom. Anybody else have anything to start us out with before we go to media questions? All right, we are ready for media questions.
Well, kind of a nuts and bolts question. When do we go into the purple tier? How long, how many weeks is that? Where do we stand right now?
We have 3 days to get into, to comply with the state regulations. I'm not sure if that pushes us to Saturday. Generally, it's when the tier is moved on Tuesday, and that puts us into on Friday where it would need to be implemented. And you have to be in a tier for 3 weeks before you can be brought back down to a restricted tier. So oh, there we go. So we would have to be measure in the red tier for 2 weeks consecutively before the state would consider putting us back into that red level. So we've got some time right now to kind of hunker down and do our best to get those case numbers back down.
So for, I guess, maybe Dr. Ramstrom or Donnell, how do we get there? I'm just thinking of like Butte County's numbers were very high and now they're very low. They've done something. I know that all you health people talk back and forth. What do we do best? Is there anything beyond? I know the social distancing and wearing a mask but what can we do as a community to try to get that number low quickly?
Right, and we really need the community's participation and help with that. And that involves, it does involve the physical distancing and mask use. So it involves not gathering with groups of people, limiting contact with other people, and just sort of staying close to home or being outdoors with just your family, not going to settings that have people in close contact, especially indoors. We highly recommend avoiding social gatherings. That's where transmission can readily happen, especially if it brings people from multiple households or multiple areas. That's what's going to be necessary. And we're doing our best in terms of talking to people who've been identified cases, helping them to identify close contacts, and recommending those individuals get tested. But that's just one piece of the puzzle, and we can only do that to a certain extent right now. Our staff are having to focus on these really vulnerable settings, and so we don't have as much time for these our community members who aren't in those kinds of situations. We need them to, if they get a positive test, they need to stay home for 10 days and they're feeling better, and they need to think about who their close contacts are and let those individuals know, and we recommend that they go get tested. This is just a time where we all just need to stay close to home, only go out and about and doing the things that are really necessary, and avoiding those social kinds of interactions.
The numbers are high. Does that indicate that maybe compliance is less than ideal?
I think the answer is yes, Mike.
Right, people are interacting, and that's where they come into contact with somebody who maybe they don't have symptoms, or they have mild symptoms. They think it's not something that's significant, and the next thing you know, you have cases, and then they take it home, and then their household's exposed. So that's how it spreads.
Can we expect more enforcement actions by state agencies now that we have more of a spotlight on us?
We have been told that state agencies are taking particular focus on communities that are in the purple tier. So that's possible.
think that one thing I want to add is that the risk of encountering the virus has gone up in our community. And so when there's higher risk, then we need to change our behavior accordingly. And I know there's a lot of people out there that are younger and maybe don't feel like the virus is going to cause them a serious illness. And I'm not going to dispute that that's the case. That is what we see in younger populations. But this is a communicable disease. This isn't a bee sting or a sprained ankle. That if you participate in a risky activity, you might get one of those things and it's going to affect you personally. This is a communicable disease. So if you get it, you can pass it to others. And we've seen that in the community. We've seen that across the country, actually, when these sorts of spikes start in the younger population, folks in their 20s in particular, who are in a developmental stage where they socialize with a lot of people outside their household. It's completely normal. But then several weeks later, we start to see cases in the older population. And that's just the way it works. And then those older people are more vulnerable to having a serious case of COVID and maybe even ending up in the hospital, ICU, or dying. So right now we have, I think, 13 people in the hospital and 4 in the ICU. Some people may think that's a low number, but if we don't get on top of it now, then those numbers will go up, and we will see more people suffering at that serious level, and the hospitals will begin to feel the pressure of all those cases needing those intensive care services. So now is the time for us all to join together and reduce our activities so we can respond to the higher risk. If you've had a gathering in the past, maybe you were fortunate and nobody there had the virus, so you didn't see anybody get sick. And you may think, well, we had that gathering before and everything was fine, so why don't we go ahead and do that again? The change that's happened is the virus is circulating much more widely now. It's not concentrated in 1 or 2 places. It's not at a low level. It's at a much higher level, and it's all over. We're seeing it in all kinds of workplaces. We're seeing it in all kinds of medical settings. We're seeing it in all kinds of educational settings. So it's all over. And so the best thing to do, again, is stay home with your household. And continue to be creative in ways to do things together in that setting. And now as we move into the cold and flu season, it's very important people stay home when they're sick, even if they don't have COVID. That's going to help your friends and neighbors and family members. You're not going to be transmitting other cold and flu viruses to others. So this is a chance for us all to participate. And then in response to your question about Butte County, Mike, we have talked to them. They did have several large institutions with outbreaks. They had their jail had an outbreak. They had several skilled nursing facilities, and they had an outbreak at CSU Chico. One thing they did is they used the institution of the university to try to change some of the students' behavior by some disciplinary measures. They also suspended all their in-person instruction for the rest of the semester. So, those are some of the things they did. And I'm happy to report that Bethel School Supernatural Ministry, although they did start in-person instruction this week, they're doing so in a hybrid model, and they've severely reduced the amount of contact the students have with each other, and they're confining the students to certain groups. And so that hopefully will reduce risk there. And they do not have any cases currently at the school. So, we all need to be looking at what we can change in our organizations, our businesses, and in our personal behavior so that we can reduce the number of cases.
Maybe this is a question for Mark Mitchelson. In the ICU, I was just reflecting on my son who's an ICU doctor out of state. But when a COVID patient gets into the ICU, it typically ties up that bed for a long time, does it not?
It has a ability to, yes. Sometimes, nationwide, we've seen these individuals needing to be in ICU for a very long time, 2 to 3 weeks plus. Some of them turn around very quickly, but others stay in there for a very long time because it can take a while for them to respond to treatment. So absolutely, it has the chance.
Well, my son's in Nebraska, and they're having a huge outbreak over there. They've overwhelmed the hospitals. They're having to stretch their ICU nurses, like ratio-wise. It's a scenario we don't want to see here, right? So we have to take these steps of masking, distancing. I know it's a repeat, but really these are things we need to do to avoid that horrible scenario. And I can't begin to tell you, it's got to be in there. I'm just really hoping after the fog of the election is over and masking and distancing becomes less political, hopefully, then hopefully the science will be back in place and we'll understand the importance of this to protect our community and get our businesses open again. Really.
And speaking of businesses, if we go into the purple tier, what kind of restrictions should we be looking for and when would they start?
There is a chart on shastaready.org. If you click on Roadmap to Recovery, there's a chart that shows all of the different changes that would take place. It does require many businesses to stop indoor operations and go to outdoor only, including restaurants, places of worship, movie theaters, things like that. But the entire list is on shastaready.org. It lists all of those different restrictions. And we have 3 days to comply with the new requirements.
Yeah, and I just wanted to follow up on Donnell's comment too. So BSSM, when their outbreak resolved, did go to hybrid instruction, which was really good. But now that we're going into the purple, all of our institutes of higher education have to stop in-person instruction with some caveats for labs and that kinds of thing. But those kinds of things. But so that's another change in addition to the modifications for our businesses. And I just wanted to build on what Dean was saying, that right now is, we have to make individual choices. Do we want kids in school or do we want to go to that social gathering, right? Those are the choices that we have to make. Do we want our businesses open or is it more important to have that social gathering? And, these are just some, I would think, minor personal sacrifices for the greater good of our community. And we just all have to kind of weigh those options right now on a personal, individual basis. And I would hope that we want our kids to be in school and our businesses to be open. And for these health facilities to not be overwhelmed. In addition to the hospitals, there's a variety of residential health facilities in our community that are now impacted.
Well, okay, doctor, I want to make sure that we get that clarified because I understood before that schools that were in session could stay in session, but you just said schools of higher education, they have to, they can no longer be in session like BSSM and Simpson University? Right.
K through 12 is good. K through 12 is fine to continue. If they've been open to in-person instruction, they can continue. They sometimes have to close because of cases, but institutes of higher education, that's correct. So once we're in the in a purple tier, they have to be closed for indoor lectures and student gatherings.
Well, I'd like to ask about businesses a little bit also. The mantra in Shasta County has been education, not enforcement. And there is, as we said, the state, but what puts teeth into this to prevent businesses from just staying open? They're trying to stay open. They're trying to, make a living and all that. And we've heard that, consistently over time. What is there that will make businesses comply with the purple tier restrictions?
I think if you look at many businesses are just the restrictions limit their capacity. There are certain kinds of businesses, they're allowed to be open but outdoors. And so then it's a matter of feasibility for them to be able to do that, such as with gyms, for example. And our restaurants, we recognize that it's challenging for some restaurants to go outside. So, we would encourage people in the community then to order more takeout from your favorite restaurants, and perhaps do curbside pickup for retail. But many of those businesses are open. They're just decreasing their capacity, or they have to do outdoors types of services. And we'll continue to work with the businesses as we have.
Any other questions?
But I had a question. Besides the restrictions that will go into place once we get into the purple tier, are there other types of activities that you think would be beneficial, even if they're not on the official state's list of things that have to be done when you're in a purple tier? What kind of things would you like to see that might be personalized for our community?
I'm not sure I understand the question. You mean in certain types of business settings or overall?
Just overall.
Overall, not going to social gatherings like we've been talking about. Really, it's a matter of just trying to stay close to home. There's this concept too about your social bubble, and so all of us should have our 2 or 3 close household family members or friends that we have made a commitment to be around, and that's it. In terms of close contacts, and we're all keeping each other, we're comfortable with the amount of exposure each other is having, and that we think that we're safe. And so those are the kinds of commitments we need people to make, and that you are, interacting outdoors as much as possible. But really, we need people not to have mixing of various households and people from different parts of the community or outside of the community. It really increases the risk. We've seen a few cases lately where people have traveled to other states and come back, and they learn when they come home, oh, somebody that they saw there was, was confirmed, and then this individual gets confirmed as well. They get infected. We've seen people have family visit from out of the area and stay with the family for a long weekend, and next thing you know, that whole household is infected. Person was fine when they were here, and then a couple days later, they realized that they were not feeling well, and they have a positive test. So that's the thing, is that we just need to be extra vigilant about not mixing with people that are not in our normal group that we're interacting with in a safe manner on a regular basis. Whether that's your household. I know for families, sometimes they'll have, 1 or 2 families on their block, and they've committed. Those are the only groups that their kids interact with. And so that's and they're being safe, and they do that in a manner that feels comfortable because they aren't exposed to other people. And so limiting the number of people we're around can make a difference. Again, being outdoors as much as possible. Ventilation makes a difference. So you want to be outdoors, distance from each other, and masking, as we've been talking about.
Another thing that community members can do is get tested for COVID at our various sites for that. The main one being at Shasta College. There's also one in Red Bluff. We're hoping to be adding some resources for testing in the next couple months. But testing is important because it helps us identify asymptomatic cases in the community, which can prevent transmission in other people. In addition, the state does give us an adjusted case rate based on our testing volume. So the more tests we do, the more adjustment we get on the case rate, which helps us lower it, and hopefully will get us back to a lower tier faster. In addition, the testing positivity rate is another one of the measures the state's using to determine the tier level. And if we're only testing contacts of cases, we're going to have a high testing positivity rate. If we have a lot of asymptomatic tests, then that's going to lower our testing positivity rate. And as was reported earlier, our testing positivity right now is actually in a lower tier than purple, which is a good thing. We need to keep it. We want to keep it there. So that is something everyone can do, and business people as well should think about having their employees tested regularly, and they can send them over to with Shasta College through the appointment system online to get those tests, which is going to help everyone.
Thank you. Which assisted living facilities are now involved with cases?
We have small numbers across 15 or 16 various types of congregate living facilities that our staff are working with right now to implement infection control interventions to reduce spread in those settings. So there's several of them.
So you're saying congregate living facilities, so not just nursing homes. They're across what titles of businesses there?
Right. So so these are skilled nursing facilities, assisted living facilities, various types of group homes for various types of populations. There are congregate types of mental health facilities, residential facilities. So there are several different types of those facilities across our community, and many of them have a handful of cases. We don't have evidence of ongoing, like an outbreak, ongoing transmission in any of these as of yet. We have a couple that we're investigating that we're worried that that's the case right now, but most of them hopefully we'll be able to do like a testing response and get people doing the right kinds of personal protective equipment use and that kind of a thing, and prevent spread from continuing. But again, the reminder is really, if you work in these kinds of facilities, those individuals need to take extra care around in their personal lives about who, stay close to home and try not to have social interactions, because that's how these facilities have the infection introduced into them, is from the staff. We see that over and over again. So does that answer your question?
Yes, thank you.
Any other questions?
Advice for Thanksgiving, since it seems like it inherently involves travel and gatherings and different branches of a family coming together. Should we not go over the river and through the woods to grandmother's house this year?
Yeah, we are working actively this week on getting some written tips together for our community members to use when they're thinking about the holidays this year, and how to develop plans that are going to be safe for your family. And so you're right. I think over the woods, over the hills and through the woods, probably not a great idea unless it's just with your family to an isolated cabin somewhere. That sounds nice. But so absolutely, limiting again the number of people and households that are getting together. We do not recommend traveling. We recognize sometimes that whether there's an elderly parent or something like that that needs care, but limiting travel out of the county and limiting travel of your family members coming here, and kind of limiting the number of those families that you're interacting with. Testing, is a good idea, as Donnell was talking about, especially if somebody's visiting. Testing before they come is a great idea, and so we'll be putting together some additional tips that can be used thinking ahead. And those should be out hopefully later this week.
Dr. Ramstrom, the testing at the college, what's the latest on turnaround for results that you're hearing?
Yeah, turnaround has been pretty good, but their capacity is limited right now, and we're not sure why. We're in conversations with the state. Some additional state testing resources are coming to us soon. We are hopeful of that. We had a call with the state last night. There's a menu of different types of resources that we have requested, and so they're doing an assessment, and we'll make those decisions next week. And those will start the following week. And so we're hoping to get an additional testing site like we have at Shasta College. So we'll have an additional location We are also requesting teams that could go out into regional locations in the community on designated days and be available for testing. There are a couple other strategies. One are these kind of self-collection kits that might be used by a particular employer, for example, and then we package them up and send them to the lab to get tested with a 1 or 2 day turnaround. So those are some of that wish list is going to hopefully transpire in the next couple of weeks. We're not sure which of those options we will get, but we're really looking forward to at least that brick and mortar, the additional testing site, so we have more capacity. And so that'll be another 165 tests a day, including some walk-in appointments to not just having to schedule in advance. So we're hoping that's going to be coming in the next couple of weeks, because we recognize, especially with our increased case counts, we don't have enough access to testing right now. We just don't. And
is the testing site in Southern California, the state was opening, is that open now? Are they starting to take
the lab? Yes, we actually just learned that there, so the PerkinElmer lab that's been built in Southern California is actually Shasta College, the state testing site out there, has been sending specimens to them this week. And that lab is able to turn around tests within 24 to 48 hours once they receive them. And so our turnaround time should improve as well. They're expecting to start with a capacity of 40,000 tests a day and go up to 150,000 tests per day in the next 2 to 3 months. And that'll about double our state testing capacity that we have right now.
Thank you.
Can you remind us, Dr. Ramstrom, what the incubation period is? Say if someone is exposed, gets the virus in them, how many days before that will show up in a test?
Yeah, we normally recommend testing at about 5 to 7 days or so after you're exposed to someone, and then at 14 days as well. So those seem to be about the right time frame for picking up the virus on a test.
Thank you.
All right, any other questions?
I just one last comment, as I was sharing, so we have, with our high numbers right now, our staff are really trying to focus and have been pulled to these vulnerable congregate types of residential facilities. And so if you know you have had a positive test and you haven't heard from public health, please isolate at home, and that's for that 10-day period, and start identifying who you might have been in close contact with as far as 2 days before your symptoms started. And there's instructions on Shasta Ready. If you click on isolation quarantine at the very top of the page, you can find instructions on how to isolate at home and how to start thinking about identifying close contacts, so you can let your friends and colleagues and coworkers know that they may have been exposed while you're waiting to be contacted by public health.
Thank you. Great, important reminder. Any other questions from the media? Any other comments from our panelists? Okay, so next week, our regular media briefing falls on a holiday. Next Wednesday is Veterans Day. So we are changing our media briefing for next week only to Tuesday at the same time, 11 o'clock, but on Tuesday instead of Wednesday. So we will see you next Tuesday. And everyone, please stay safe and healthy. Have a great rest of your week.